Hi everyone, welcome to Nursing with Beatrice. I am Beatrice. We'll be concluding the topic on burns. Today we'll be looking at treatment and management of burns. I've tried to kind of break it down under some headings just to help us understand it better. Under respiratory, we look at airway management. This patient may have suffered inhalation injury. Some signs that they might have suffered this is maybe they are exposed to fire, like house fire, they are in an enclosed place, the face or the neck appear red, they may be anxious, they may be agitated. So that would be a sign they may have suffered inhalation injury. And this will predispose them to carbon monoxide poisoning. Carbon monoxide is an odorless and colorless gas, very poisonous, but the patient may not even know they've sustained this poisoning or they've sustained the injury. So for this patient, we give them 100% oxygen via a non-rebreather mask, just to help them blow off those excess carbon monoxide. We monitor arterial blood gases because patients with burn may suffer metabolic acidosis. And also, because of CO2 poisoning, we want to make sure that we monitor the carboxy hemoglobin level. The carboxy hemoglobin has to do with when carbon monoxide bind with hemoglobin in the blood. We know that hemoglobin is the oxygen carrying capacity of the blood. So when carbon monoxide enters somebody's body, it has strong affinity for hemoglobin, so it displaces the oxygen and takes over, and that could be very dangerous. So we want to make sure that the carboxy hemoglobin level is less than 15%. Next, we look at the heart. Now, if you recall, when we describe the types of burn, like for instance, the electrical burn, we say it could affect the heart and could make the patient go into cardiac arrhythmia. So we may put them on ECG to monitor them, ECG monitoring. We monitor the vitals, and especially the blood pressure, which may be low. We want to monitor it closely. We monitor the heart rate, which may be high. And generally, even the temperature, because they may suffer hypothermia. We check the vitals and generally the respiration and all that, the SpO2. In the kidney, we want to maintain fluid and electrolyte balance because they may lose fluid and they will lose electrolyte, particularly sodium and potassium. The sodium will not be balanced with the potassium. They may suffer hyponatremia, low sodium, and hyperkalemia, high potassium. Now the fluid, because of the loss, fluid shift and all that, we want to replace fluid loss. We use most times they prescribe Ringer's lactate. And if albumin is affected, they may prescribe albumin. We want to ensure that the urine output is okay, between 30 to 50 ml in 1 hour. We insert Foley so that we'll be able to monitor street intake and output. We measure the patient weight and monitor it closely. We watch for signs of successful resuscitation of fluid, like stable vital sign, improved level of consciousness, increased urine output up to 30 to 50 ml per hour, and the peripheral pulses being palpable. Now we move to the gastrointestinal tract. If you remember, we talked about colon ulcer. That is when there is too much acid in the stomach as a result of decreased blood volume, and then the stomach wall is eroded. So we manage this one. We can use the proton pump inhibitors or histamine receptor blockers. We place the patient on nothing by mouth because of intestinal decreased intestinal motility, which is what we call intestinal ileus. So that at least for the first 24 to 48 hours, we don't want any food to go in there. And also depending on the extent of damage. If we look at the extremities, patient may suffer edema, swelling. They may also suffer edema even on other parts of the body. So we want to elevate the extremities, the hands and the legs. And also because of that eschar formation, or there may be pressure in the fascias, so the patient may suffer compartment syndrome, and this can be very painful. So we manage with opioids. And also, depending on the severity of the compartment syndrome, if it's not relieved, they may do sclerotomy, they may do fasciotomy, where they make incision through the fascia, and just to relieve that pressure, because it can really be very painful. On the skin, we manage the wound, we care for the wound, we ensure that there's no infection, so we follow standard procedure. We use our PPE, and because this patient also, their immune system may be down, so we don't want to add more trouble to them. We monitor their temperature very well because they may be at risk of hypothermia because of decreased blood volume and decreased oxygen saturating in the body. We maintain hand hygiene. Always wash your hand before you touch this patient and even after touching them. Nutrition, this patient have gone through a lot, so we want to give them diet that are high in carb, high in protein, vitamins, mineral, salt, and fat. Finally, rehabilitation, very important. After a patient has suffered burn, they may suffer self-esteem issues. You know, their beauty may be affected. So if reconstructive surgery or cosmetic surgery, we do it. Why not? We encourage them to go for this. And also want to ensure that they are nursed to independence. So activities of daily living will ensure that they're able to do some of those things they've not done before. This is where we involve other healthcare professionals like the OT and the PT. The OT may help them with using working aids if they are having some pain in the joint, or they are not able to use their joints or do some things properly. And the PT will help them with exercising their limbs, the hand, to prevent contractures. Look at how to estimate the extent of burns or the percentage of burns. We need this, the percentage, and also the next one we'll be talking about will be Parkland's formula. We need to put these two together to be able to know the amount of fluid we use in resuscitating patients. The first thing we need to look at is the Wallace rule of nines. So we have Wallace rule of nines. So this is the Wallace rule of nines. It says head and neck 9%. It means the anterior head and anterior neck together will give us 4.5%. The next one is arms. The arms is 18%. It means each arm is 9%. That means if we're only looking at the anterior arm, for example, that will be 4.5%. The next one is trunk. The trunk is 36%, meaning the anterior trunk will be 18%, posterior trunk will be 18%. And if we look at the anterior trunk, it is made up of the chest and the abdomen. It means each will be 9%. We have the legs. The legs is 36%, meaning each leg is 18%. And finally, we have the perineum. We're going to apply this using examples. The first question says, a patient has burns to the anterior chest. So write down anterior chest, anterior abdomen, and the entire left arm. That's the left arm. It says entire, that's the left arm. Using the rule of nines, what percentage of total body surface area is burned? So anterior chest, remember I said anterior chest and anterior abdomen will give us anterior trunk. So the two is 18%, meaning each is 9%. Entire left arm means the left arm. That will give us 9%. So let's see the percentage. We'll add it together. That is 9 plus 9 plus 9 equals to 27% of total body surface area affected. Let's see the second example. It says a client sustained burns to the anterior head and neck. So that's for example 2, anterior head and neck. Front and back of the right arm. Front and back of the right arm. That is entire right arm. Front and back is entire of right arm. And posterior trunk. What percentage of total body surface area is burned? So anterior head and neck, since the entire head and neck, both anterior and posterior, is 9%, so this will give us 4.5%. Front and back of right arm means the entire right arm. That will give us what? 9%. Posterior trunk. Remember, anterior trunk is 18%, posterior trunk is 18%. So the total percentage of total body surface area affected is 4.5% plus 9% plus 18%. So this will give us 31.5% of total body surface area affected. So yes, 31.5%. Okay, so let's look at the Parkland formula. When we're discussing management of burns, we said one of them is resuscitation with fluids because they will lose fluids. So the formula we use is the Parkland formula. Although we can't use this formula without knowing the percentage of total body surface area affected, which we have done using the Wallace rule of 9s. So the Parkland formula says 4 ml of the fluid, most time we use Ringer's lactate, multiplied by the patient weight in kilogram, multiplied by the percentage of total body surface area, which is what we have calculated using Wallace rule of 9s. Let's see examples. A client has burns over 30% of their body and weighs 70 kilograms. How much fluid should the client receive in the first 24 hours? So as a way of illustration and more explanation, when we calculate for the first 24 hours, we don't load the patient at once. We divide the fluids. So when we know the amount in 24 hours, for the first 8 hours, we give half of the fluid, and the last 16 hours, we give the remaining half. We'll see how we'll do that now. So let's see this first question, how to solve it. So the patient has burns over 30% of their body. So it means the total body surface area affected in terms of percentage has been calculated is 30%. The patient weighs 70 kilograms, so the weight is 70 kg. So how much fluid should we use? So with Parkland formula, we say 4 times weight is already in kilograms, so we're not converting, times the percentage, which is 30. If we do this, this will give us 8,400 ml. And since the question says in the first 24 hours, so this is what the patient should receive, this amount in first 24 hours. Remember I said we won't load the patient with this at once. We'll divide it into 2. But for the question, the answer will be 8,400 ml. But if they are asking you to explain further, you say this 8,400 ml, you will divide it by 2. So 8,400 divided by 2, that will give you 4,200 ml. So 4,200 ml you give in the first 8 hours. And you give the remaining 4,200 ml in the remaining 16 hours. So that's for this one. Let's see the second question. It says calculate fluid needs for a client with burns in the first 8 hours. So this time around it's saying for the first 8 hours. Client weighs 154 pounds. So the weight is 154 pounds. But we need to convert. We need to convert this. So 154 pounds to convert to kilogram, we divide by 2.2. If we do that, we'll still get 70 kilograms. And the client has burns to the anterior right arm. So we're going to use the Wallace rule of 9, anterior right arm. So if the entire right arm is 9, anterior will be 4.5%. Anterior right leg, anterior right leg. So if each leg is 18%, anterior right leg will be 9%. And say posterior head and neck. Posterior head and neck. Since the entire head and neck, both anterior and posterior, is 9%, so only posterior will be 4.5%. So if we add this together, 4.5 plus 9 plus 4.5 again, definitely we are going to get 18% of the TBSA. So how do we put it? Let's put it into the formula. The formula is 4 ml, so we say 4 times the weight. From what we calculated, we got 70 kilograms, times the total body surface area affected, the percentage, which is 18%. So if we do this together, multiply this, we are going to get 5,040 ml. Remember, this is going to be for 24 hours, but the question says in the first 8 hours. And I remember I told you for the first 8 hours, we'll divide it by 2 to give half. So if we divide it by 2 for first 8 hours, that's 5,040 divided by 2. That will give us 2,520 meals. So this is what we'll give for this question in the first 8 hours. So that wraps up the lesson for today. If you enjoyed this topic, please like, share, and subscribe for more educational content. Thanks for watching.